One of the challenges in fitting conventional sockets is with a static socket shape, even if it's an adjustable conventional socket, you're pushing or pulling soft tissue into a contained rigid bucket. And because the above-the-knee limb can act more similar to shoving a water balloon into a jar, you often will have ballooning of tissue out the top of the socket. And over time, that can lead to adductor rolls and just difficulty in donning the prosthetic. In fact, if you're using a pin system, it can be especially difficult to even get that pin to engage in the bottom of the socket if you have enough compression around the limb. So the Slingshot socket fits entirely different. The way that we're fitting this socket is we're actually wrapping the socket around the limb in real time versus shoving the water balloon into a jar scenario. So we can completely splay open the socket, allow the brim to be whatever size that we want it to be. In fact, we even have an option for containment straps where we can loosen them as well. Both loosening through the dial or an extra opening option that allows the entire socket to splay open. So if you have a patient with maybe a large adductor roll or just a lot of excess tissue, maybe an overweight patient that has trouble donning all that tissue down into a conventional socket, we can open this entire socket up, wrap the socket around the limb, and then once it's fully seated in the limb, we can just simply reconnect and then still have the full micro adjustability of our dials. Now, this is especially helpful for those patients with adductor rolls or extra tissue. And what we found in clinical practice is that this has been pretty life-changing for that population. They can don the Slingshot socket in sitting. You can actually see the pins. If you're using a pin system, you can see the pin guiding into the pin system. You're not trying to stab it blind. And by fully wrapping that limb tissue, wrapping the socket around that limb tissue in real time, they're fully seated into the socket. They have better control, better stability, and a much simpler time donning the prosthesis. Ultimately, that just adds to increased quality of life.